We're outside the federal courthouse in Dallas, where we have been watching day 5 of the federal trial of Dr. Reynaldo Ortiz. He's been accused of poisoning IV bags in an effort to thwart other doctors' surgeries. This is my producer, Kelsey Mittauer. I'm Andrea Lucia, and we have been sitting, you or I, through every moment of this trial. Let me start by asking you what you think the most compelling evidence, the strongest evidence has been that the prosecution has presented so far.
Dr. Chad Marston, he was yesterday, right? Okay, so his testimony I feel like was the most compelling. He talked about, he walked through a lot of the videos. He talked about getting handed a bag in surgery, and he said the bag was cold. And they were trying to link Dr. Ortiz's, putting a bag in the warmer and then showing a video of the tech going and getting it and taking it to Dr. Marston. And he said he remembered, like, this bag is cold. He specifically remembered that because he was actually going to say something to the tech about it. And then they also walked him through this video of Dr.
And just to expand on that, because I know when we first started looking at it, we didn't know what a warmer was.
True.
But it looks like a refrigerator, but
Yes.
it does the exact opposite. It warms
The bags.
the IV bags, blankets, things like that. And the fact that the IV bag was cold is significant because it hadn't spent that much time in the warmer.
Yes, and they actually showed video. We had to sit through a lot of video where they showed 40 minutes leading up to when that tech pulled the bag out for Dr. Marston. And so the only person at the warmer in that 40 minutes is Dr. Ortiz putting a bag in, I think it was like 5 minutes or so, 5-10 minutes maybe, before the tech went and pulled the bag. So the prosecution was really trying to link the bag that Dr. Ortiz put in with the bag that the tech pulled out and handed to Dr. Marston.
Okay.
So there was that, and then they walked through a lot of video. I'd never before seen video. A lot of the videos we've seen, right? Like we've seen them over and over again. These were videos of Dr. Ortiz doing things that Dr. Marston called bizarre. He had pulled out these really large syringes, and he was drawing from vials, and Dr. Marston said that it looked like he was mixing medications, and he was doing this, like preparing these 2 large needles in the pre-op area, which Dr. Marston said normally you don't fill needles in the pre-op area, and you don't mix medicines like that. And so they were making the point, you see him walking all around the pre-op area with these 2 needles in his front pocket, and then he goes into an OR, and then when he comes out, the video they showed, the syringes were not there. So I felt like that video, when people were watching it in the courtroom, there were people who work at that surgical center in there shaking their heads. John Casper, the husband of Dr. Melanie Casper, who died, he started crying. I mean, there was a lot of emotion in there. One of the youngest patient was sitting behind me with his mom, and you could hear that it was just kind of a stunned silence in there seeing this video play out.
And just to give some context to who Dr. Marston is, he is an anesthesiologist. He was the anesthesiologist for one of the patients believed to have been affected by one of these tainted IV bags. And if I remember, I mean, he was so bothered, he was losing sleep after this surgery took a turn, and his patient suffered complications, was trying to figure out what went wrong, and thought, it seems like there's something to do with the IV bag. And so he was pulling up a few days later, pulling up to the Baylor Scott and White Surgicare Center in North Dallas, saw an ambulance outside, or a couple ambulances, and ran in to check, see if it was happening again, and told them to
change the IV bag.
Change the IV bag.
He said, go get an IV bag from an unopened box, like not the warmer.
Yeah.
Go get a completely new one. Because to hear him tell it, he figured out it was the IV bags like the week before. He had been thinking about this, and he said he had lost sleep and all this, and so that was the only thing he could figure out was something, because all the doctors have said, I mean, you've heard them, that nothing made sense, right?
Right. They couldn't think of a reasonable explanation for what had happened in their surgeries.
Yeah.
Everything was going fine, and then suddenly there'd be these complications that would arise. And so the other thing I think is significant that Marston did, other than help the patient who was having the complication in the moment, is to tell a hospital administrator, hold on to the IV bag. And that really preserved evidence that could be tested later to
Right.
find that drugs had been added to that IV bag.
Yeah, and the shell. the plastic casing of the IV bag. He talked about that. I mean, really, yeah, his role in this, I don't think, cannot be understated. His role in the investigation and in the trial.
Yeah.
So, I mean, what do you think? You've seen so much testimony this week. Like, what stands out to you?
It means the videos.
Yeah.
It's the videos. And the video that you described is probably more direct, but some of the videos that stick out to me are the ones where they showed a lot of videos of him like taking bags out of the warmer, putting bags in. It's the videos where he's just walking up to the warmer and peeking inside and closing the door, because I think I just don't know how they're going to explain that. Like, what is the reason for him doing that? And then also, I try to be objective in how I describe these videos, but so I don't want to use the word suspicious, but he is looking around when he's doing that. When he's around the warmer, you see him moving his head, looking around, and there was one where he's reaching for the warmer and somebody walks into the hallway and
you can see his arm, yeah.
He pulls his arm away. So he's definitely acting in a way that makes it seem like he does not want people to see what he's doing. And that behavior just...
When you see it in comparison with all the other doctors, because like we've said, we've seen a lot of videos this week. When you see it compared to everybody else, like it just, everybody else is so nonchalant, like walking,
right,
going, grabbing something. It's not a big deal, but yeah, some of his behavior really stands in contrast to the other doctors and nurses.
Yeah, absolutely.
So, yeah. And then I think, I don't know, I would say, like, hearing from the patients, we kind of expected that. We saw them on the witness list, but we've heard from all 4 patients who are named, who he's, charged with. I felt like some of their testimony, I mean, these surgeries and the complications, the cardiac emergencies, really impacted them for months afterwards, still impact them. And I feel like the gallery has kind of grown as the week has gone on, right? Like, as they release witnesses, now we're sitting with them.
Right. And now I imagine, from the jury's perspective, if they turn and they look into the gallery, they can see the patients that they've heard from, the doctors that they've heard from. And some of the emotional testimony hasn't just been limited to the patients. It's been the hospital administrator.
Yes.
One of the anesthesiologists, I remember, was just talking about the moment when everything was going wrong. He talked about it, how emotional it was, how difficult it was.
Yeah, it really you could tell that these emergencies bothered them, just because they were so unexplainable according to them.
And unusual. They talked about how rare it is in their surgical experience to have things like that happen.
Yeah, I think the other thing that has stuck out to me is that how difficult this case is for attorneys to try. It is such a medical case. The medical jargon, we're all in there learning together, right?
Right.
And so, especially on the defense, it feels, I feel for them, because you're having to kind of try to poke holes in a surgery. You're asking questions of that doctor and that anesthesiologist, like, could you have done this wrong, or why did you do this? And they have answers for a lot of it, right? And it's because we aren't doctors. They aren't doctors. Those attorneys have done a lot of research and a lot of studying, I'm sure, but it's just the medical jargon sometimes, I think, is beyond almost everybody in there.
Well, the medical jargon, and then today we heard from a chemist, a forensic chemist, and we also heard from a financial investigator. So we're talking about chemistry, we're talking about surgery, we're talking about anesthesiology, we're talking about medicines, we're talking about taxes.
It's all.
Yeah, it's a very complicated trial. Each side not only has to sort of make their case, but they have to make it in a way that the jurors can understand. These are everyday people like you and me. Really, anybody can be called to be a juror, and not necessarily anybody with medical experience or financial knowledge. So
I think we're a couple of days, maybe a day or two away from the prosecution resting, and I'm interested to see how they wrap up and then what the defense puts on.
Yeah, I will say one thing that stuck out to me listening to the patients. The very first patient that we heard from, I think, talked about she was in surgery. She was getting a lower facelift, and the surgery couldn't be completed because in the middle of it, everything went crazy. Her heart rate spiked, and so they wrapped up her face. She wakes up in a different hospital in pain, and she had what she described as a third ear, and I can only imagine, like, you know, it was just unfinished surgery, and it stayed there for almost 2 years.
Because she was too afraid to go back in. Yeah, well, and then the 18-year-old, the youngest patient, he had gone in for a rhinoplasty. His nose had been broken and he was having trouble breathing. And he said when his emergency happened in the middle of his surgery, and he said when he woke up in the ER or in the ICU, he looked like Voldemort, is what he said. Like they hadn't even finished his nose. And the doctor even talked about he just like stitched it up really fast.
Right. Yeah.
So yeah, I mean, it happened I think at least for those two, like happened in the middle of crucial moments of surgery.
Right. Yeah. And but just that fear, you know, on the one hand, you need your surgery completed. On the other hand, just the fear that this would happen again.
Yeah,
the fear of being put under after having an experience like that.
Yeah.
Yeah. All right. Well, it's day 5. It's not over, and of course we have next week. So we'll
be back.
We'll be back.